Hello students, my name is Raju Hendik, Assistant Professor, Assam Downtown University. Today I'm here to discuss with you all about the different functions of an hospital. So before moving forward, let's discuss what is an hospital. So as defined by the World Health Organization Expert Committee, a hospital is a residential establishment which provides short-term and long-term medical care consisting of observational, diagnostic, therapeutic, and rehabilitative services for persons suffering or suspected to be suffering from a disease or injury, and for parturients. It may or may not also provide services for ambulatory patients on an outpatient basis. So, as defined by the expert committee, the hospital is an integral part of a social and medical organization, the function of which is to provide for the population complete healthcare, both curative and preventive, and whose outpatient services reach out to the family in its home environment. The hospital is also a center for the training of health workers and for biosocial research. So as you can see, the primary functions of an hospital is investigation, diagnosis and care of the sick and the injured. While it has while other than that, it has other functions also. Some of them are health supervision and prevention of disease, education of healthcare providers, rehabilitation, and healthcare research. So, hospital functions: intramural services within the wall of the hospital, and extramural services outside the wall of the hospital, that is outpatient department, outreach services, medical camps, immunization programs, etc. The different functions of an hospital. Intramural functions. Intramural functions include therapeutic, preventive, and education. The therapeutic part, in the therapeutic part, the hospital perform different functions like diagnostic, curative, rehabilitative, and care for emergencies. In the preventive part, it works with the antenatal and the postnatal services, baby clinics and immunization schedule, family welfare services, control of communicable disease, and health education. For the education, in the education sector, the hospitals conducts medical education for the undergraduate, postgraduate, and postdoctoral students. Nursing educations is also provided for the undergraduate, postgraduate, and postdoctoral students. Specialty education is also provided, paramedical education, and community health education. The hospitals also work in the research area. In the research area, the hospital works in clinical medicine, hospital administration, etc. Then comes the extramural functions. Extramural functions are the functions that the hospital performs outside the walls of its organization, like outpatient departments, outpatient services, home care, outreach, or domiciliary services. So next we will be discussing about the preventive functions of the hospital. So it is an emerging secondary function for the hospital and concerned with health promotion. It is geared towards providing the preventive services through community healthcare. It takes an active role to improve the health of the population. The preventing care. The curative function. It is the primary function of the hospital and is concerned with providing patient care. It refers to any type of care given to the patient by the health team members, that is, physicians, nurses, or dietitians. It also includes health education to the patients. Next is the training functions. It is a secondary function and is concerned with providing training and educational courses for the professionals and technical personnels who provide health services, for example, physicians, nurses, dentists, therapists, etc. The next is the research functions of an hospital. It is secondary function and is concerned with conducting the health related research that focuses on the improvement of the health and or prevention of health. Next, we have arrived to the rehabilitative functions of an hospital. The rehabilitative services are dedicated to provide high quality, individualized, and effective interventions aimed at promoting both patient safety and a return to the independent function. Services include physical therapy, occupational therapy, and speech language therapy, etc., with compassion and empathy in a patient and a family centered care environment. Next, we have arrived to the changing role of an hospital. The role of an hospital has changed with the emphasis shifting from curative to preventive, inpatient care to outpatient care, and home care, acute to chronic illness, tertiary and secondary to primary health care. The important factors that have led to the changing role and functions of the hospitals are expansion of clientele from dying and destitute to all classes of people, improved socioeconomic status, increased health awareness, government's duty to provide comprehensive health care, improved transportation and communication services, rapid advances in medical sciences and technology, increase in population leading to increase in demand for hospital beds, reorientation of healthcare delivery system with an emphasis on primary healthcare. So I would like to end my presentation by saying that a hospital is a kind of institution which deals with the healthcare activities. It is an institution that provides treatment to the patient with specialized staff and equipments. It serves humanity as a whole and is an integral part of the social welfare of a society or a state. Thank you.